Hello, everyone, and welcome to this episode of the Optics Room. I'm so excited to have today's guest on. She is none other than the CEO of the GOC, Leonie Milliner. Leonie, that sounds a bit scary, doesn't it? CEO of the GOC.
Thank you ever so much, Hassanin. What an introduction.
Thanks for your time. Really appreciate you having you on here. Tell us a little bit about yourself and how you've ended up in the GOC and what you do now.
Well, delighted to be here. So, first of all, thank you very much indeed for inviting me to come along and participate in your podcast. My name is Leonie Milliner, and I'm the Chief Executive and Registrar at the General Optical Council. We're the statutory regulator for the optical sector. I should underline that I'm not an optometrist or a DO by training. I started my career in architecture and through some very logical leaps and bounds ended up here at the GOC, first as Director of Education and then promoted last January to Chief Executive and Registrar, a position that I occupy with a huge degree of gratitude and hopefully energy because we have some significant challenges ahead.
Definitely, definitely. I think the world is constantly changing, and if we don't keep up to date with the changes that are happening, they'll take us over, and we'll be left drowning in all the changes that's happening. So it's important to keep up to date and adjust our ways of working. So let's get down to it. What is the role of the GOC? What do you guys do for us?
Thank you. We do something that's actually quite simple. We maintain a list of names of individuals and businesses who are competent and capable in the practice of eye care as optometrists, as dispensing opticians, and as regulated body corporates is what we call them in our legislation. I think it's really important to remember that we are a creature of statute. So we are in existence because the government, Parliament, has decided that the sector requires regulation. And as many of your listeners will know, our legislation dates back to just after the post-war in the 1950s and has been regularly changed and updated since then. And we're now embarking with the Department of Health and Social Care on the next phase, if you like, of regulation within the optical sector, with potentially a new what's called Section 60 order on the horizon. So that's what we are. We're a creature of statute. We're a regulator, so what's called a health and social care regulator,
Yeah,
and part of a basket of regulators that you're probably all very familiar with. So, names like the General Medical Council, GMC, NMC, Nursing Midwifery Council, etc. So we sit as part of that regulatory infrastructure within health and social care.
fantastic. So you guys are out there to protect the public from any misconduct or any lack of care given from us towards the public. So sometimes the perception of the GOC is that it can be quite scary at times, but maybe that's how it's supposed to be in order to keep the public safe.
Yes, so our statutory objective is patient and public protection, but nested within that is a really important concept, which is about maintaining the public confidence in the professions we regulate, and it's that public confidence bit that's really important. I mean, there's an oft-repeated statistic within my world, which is that there's something like 22 million eye tests a year. And if we look at the financial year, the last year that we report at, so March 2021 to March 2022, we had something like 450 complaints. So I think in that context, that public protection piece is really important, but actually the public confidence bit is probably more important. And we do that through all sorts of interesting activities. So one of those is about setting standards for optical education and training. So, we describe what the content of the education and training and the assessment process should be in order to get on the register. And then once an optometrist or DO is on the register, how that competence is maintained through continuing professional development, what we used to call CET.
Yeah.
And that qualification approval process is really central to our sort of operation. And then second, it's about maintaining public confidence in our ability to to maintain that register, that list of names, it has to be accurate. The information that we have on there has got to be correct. And when a concern or a complaint is made, we have to investigate our registrants' fitness to practice, their ability to train or carry on a business, and whether that is impaired or not.
Great. So you just mentioned that you had 450 complaints out of a possible 22 million eye tests last year. Would you class that as a success?
That's a very interesting question. So we saw a small uptick in the number of complaints that came through to us, complaints and concerns, primarily because we were coming out of COVID. But the vast majority of those complaints and concerns are resolved before they get to a fitness to practice panel. A significant number of those complaints or concerns are around consumer relations. So they are referred on to the OCCS, which I'm sure all of your listeners are familiar with. And there's generally some positive outcome from both the patient and the optometrist or DO following that referral. So just as an example, in 21-22 we opened 109 investigations, but only 24% of those went on to become a full investigation. And they're sort of approximately balanced between sort of clinical concerns and conduct concerns, with a small number being health-related.
Fine. I was just about to ask you, what's the most popular, the most common reason for a case to go to fitness to practice?
That's a very interesting question, hasn't it? So you can read all of our fitness to practice determinations on our website, and we regularly conduct audits to try and determine what those trends might be. Because of the very small number of fitness to practice decisions, I mean, we were last year something like, I think, 27 decisions. It's really hard to pull out areas of common cause or common concern. So my suggestion would be to go onto our website if people are interested in this and read our annual fitness to practice report that we publish, and read the individual determinations. But they are approximately 40% clinically related. So that's about clinical decision making skills and the application in practice context, and about 30% around conduct. And often those are around sort of inappropriate behaviour, particularly sexual boundaries, social media, driving, drugs, those sorts of issues. And we're about to embark on a review of our professional standards. So those are the standards that registrants and body corporates, so businesses, have to adhere to, including our student community. And what we're doing over the next 6 months is we're looking at some of those sort of big themes that have come out of both fitness to practice, but also concerns raised more broadly, and having what we're calling conversations with the sector, so with professional and membership bodies, with individual registrants, with representative groups both in the developed nations and in England, and with patient and third sector organisations. And those sorts of topics align with the themes that I've just identified. So, what does it mean to be appropriately supervised in practice when you're a student, for example? What are the appropriate professional boundaries within practice? How should one conduct oneself in this online world? So those sorts of really interesting issues, and including the issue of leadership. What are your particular responsibilities if you're a leader? And what are your particular responsibilities towards bringing on the next generation of optometrists and
That's really good. That's really good. I think it's important to have a well-rounded approach rather than just don't miss a retinal detachment. Be a well-rounded optometrist, be a well-rounded DO, so that you really give a good quality of care in all aspects to the patient and to the people that you work with. Exactly. And that's the best way to improve the profession as a whole.
Exactly.
Great. So the government plans to review the GOC legislation. What do you think will be the outcome of that?
So Department of Health and Social Care has, for the last couple of years, been thinking about the best way of structuring professional regulation for that basket of professions I spoke about earlier. Back end of 2021, it had a consultation called Regulating Healthcare Professionals, and it set out some really ambitious and broad objectives for regulatory reform. We've waited quite a long time for the Department of Health to publish its analysis of consultation responses. They were published at the end of January, beginning of February. And that document, while long, I think it's 100 and something pages, published on the Department of Health's website. It's a really good read if you want to know what's
Okay,
going on.
you must be an avid reader.
But I'll try and summarize it, shall I? I'll try and summarize
Please
it.
do,
So
please.
pretty much all of our regulatory operations will be set to change, but the fundamentals won't. So the fundamentals that we will continue to regulate optometrists and DOs, will continue to regulate businesses, although we've put down a marker that we might want to do that differently, and we might want to regulate all businesses who carry out protective functions. We will continue to have a register, and we will continue to approve and quality assure qualifications in the optical sector. How we're organised might change. So the government's really keen for us to introduce something called a unitary board. So our governance might change. And some of the really old-fashioned bits of our legislation will be hopefully swept away. So if you read our legislation, we have a list of committees that we must have, and it's very prescriptive on who must sit on those committees and how long they're appointed for, etc. So we'll have a lot more flexibility moving forward in how we organise ourselves to make appropriate decisions for the benefit of patients and the public. The most important bit of the government's regulatory reform, however, is that the government wants what it's calling a blueprint for legislation. So it wants a single Section 60 order that it can apply to all regulators. And there's something about that which is about fit, if you like, because the regulators all work quite differently. And there are some parts of our operations at the GOC where we really are quite fleet of foot, and other regulators are not. And the blueprint might draw us into some middle ground that might mean that in some areas we might actually have, our work might become therefore a little bit more complicated than it is at the moment. But I think that's probably a good price to pay for having up-to-date and responsive legislation that really allows us to look to the future. And one of those new obligations that we think might be coming into our new Section 60 order is some sort of obligation around workforce supply, and making sure that there's an appropriately skilled workforce to meet patient needs of the future, which is not a statutory requirement of ours at the moment.
Why is the government giving a one-size-fits-all approach to this? Why can it not be tailored to each profession individually?
So that question might be better answered by the Department of Health.
Might have to get
a
them on
little
here.
a little bit of conjecture here, in that
Yeah.
if you look at how professional statutory regulation has emerged over the last 3 centuries, and I won't go into a little bit of a history lecture here, but it's incredibly interesting if you want to have a look at it in more detail. If you look at how it emerged, first through the medical acts and then through other professions, really from sort of the early 1900s onwards, it was a cumulative process. So different professions got statutory regulation at different points, and their legislation reflected the era at the time and lessons learned from prior acts regulating other professions. And this is a great moment to step back and say, from the government's perspective, what works really well, what doesn't work so well. Let's try and have a common approach to professional regulation, and then be profession specific where it's required. And of course, where we're different to the other statutory professions is that we regulate people, but we also are engaged in place-based regulation. And that, is not part of the regulatory system in, say, nursing or medicine, but it is in pharmacy and optics. So that makes us different, and it will mean that we'll have to pay some really close attention about what that might look like. And of course, nested within our regulation is a whole set of rules and obligations around, say, the sale and supply of optical appliances, or contact lenses, and the nature of the sight test, etc. And one of the reasons why we launched our call for evidence last year was to amass an evidence base and understand the opinion within the sector about potential changes to the optical specific sections of our Act, and what that case for change and that evidence base might look like.
Does the Department of Health and Social Care understand what's happening on the ground in practices? Or does it then rely on the GOC to say, no, actually, this needs to be done this way, this regulation won't work for us?
My understanding is that the professional and the representative bodies, so the AOP, the College of Optometrists, ABDA, etc., they all have really solid parliamentary affairs engagement activity. So as a sector, I think we're reasonably good at engaging, politicians, government officials, APPGs, etc., to enable others to understand, the impact of regulatory change on our sector. And I know that the College of Optometrists, AOP, ABDO, FODO are very active in responding to DH consultations. So I'm really confident that the sector has got the capacity to be able to organise itself to respond appropriately. And, the Chair of Council, Dr. Anne Wright, and I and other staff at the GOC regularly meet with the Department of Health. Department of Health officials came along and held a seminar with our council last Tuesday. We had a further meeting on Friday. So there's regular engagement there. And I have to say, I'm terribly impressed with officials that I meet with the Department of Health, because they're very open and willing to engage, and they very much see it as a dialogue at the moment. The draft Section 60 order for the GMC has just been published, and we're organising ourselves to respond to that. And I'm hoping that the other professional membership-based bodies will also be responding to that draft Section 60 order, because that's the blueprint that will be coming in our direction at some point in the future.
Exciting times. What's a rough timescale do you think that it will impact us?
We don't know. That's the key question, hasn't it? That is the key question. So all we know from the Department of Health is that the GMC will go first. Then it'll be the Nursing and Midwifery Council and the HCPC, who has the sort of 13 health and social care professions, podiatry, physiotherapy, etc. And then at some point it'll be us. Department of Health have said that, whoever will go next after HCPC will depend on readiness. So we've been very keen to stress to the Department of Health that, as a sector and as a regulator, we're keen and ready. It's obviously a large transformation program. Every part of our regulatory operations will have to change. That will require consulting quite significantly with the sector, and there's only a limited capacity, I think, within the sector to respond to consultations, so there will be a pace to this activity that we'll need to work through.
Great. And I guess everyone within their sector, within optometry, will be consulted and trained on the new regulations as well.
Absolutely. When we get to that stage, yes, absolutely.
Good. Great. So that's for the future. Let's go back a few months or a year or two. What changes have you guys been making to improve the quality of output from optometrists and dispensing opticians, and more so how you recently migrated from CET points to CPD points, and why?
Hasn't been what a change journey we've been on. I think that would be my response. So I came into the GOC in November, December 2019 with an explicit brief to calm nerves around the broad scale changes that the GOC was making to qualifications it approves in optometry and dispensing optics, something that everyone knows of as the ESR Education Strategic Review. That had been going on for some time, and there have been a number of consultation documents that have been issued. And I would say that was probably, in terms of the scale of change, the biggest set of changes that we've made so far until we embarked on CPD. And one of the reasons why we embarked on why we concluded the Education Strategic Review and made those changes to our education qualifications was because we needed to dramatically change the education base of the profession so that it could respond to changes more effectively and quicker that were happening, if you like, out there. Our regulatory infrastructure for the approval of qualifications was creaking at the seams, let's put it that way. We were relying on quality assurance handbooks, which were quite old in the requirements that they set out. And it put the sector significantly at risk. So those changes were all approved in February 2021, and our providers of approved qualifications are now adapting those qualifications to meet what we now call the new education and training requirements. What does that mean on the ground? It means that some students will be entering programs in September 2023 or September 2024, or maybe as late as September 2025, which will be for optometry a level 7 master's degree. which will integrate the required education and training in practice. And for our dispensing optics colleagues, will be a level 6 or degree level qualification, again, integrating within the qualification the required time in practice. So really moving from a two-stage qualification process that we have at the moment to a single qualification with that integrated education and training piece, much more akin to the education and training that you get with the other healthcare professionals enjoy. And alongside that, making some really significant changes to independent prescribing for optometrists. So there
Okay.
was some
Yeah.
would you like me to talk a little bit more about
Yes.
IP?
Yes,
Yeah,
please do.
okay.
Because
So
we did an episode on IP last year, and it was one of the most popular episodes we had.
was
So
it
our
interesting?
audience would love this.
Interesting. Well, in a piece of research that we did last year, our registrant survey showed that 40% of our registrants were really keen this year to do additional education and training. And I
Yeah.
know for optometrists in particular, IP is one of those sort of real sort of areas where there's potential for career growth. At the moment, we have some regulatory barriers in place. They're GOC barriers. They're not in our Act. Things like you have to have been on the register for 2 years before you can sit some assessments for independent prescribing. So what we've done is moving forward, removing all of those regulatory barriers. We've set new standards, so our expectations, the content of the education and training, and some standards around assessment, and made some significant changes to supervision. So rather than saying you have to be supervised by an ophthalmologist within a hospital setting, moving forward, it's the DPP, so the designated prescribing practitioner, which could be an ophthalmologist, it could be an experienced optom, it could be a nurse, for example, who's competent within that area to supervise you. The providers, the universities, are now beginning to plot out their transition journey to be able to deliver these independent prescribing courses, hopefully alongside the level 7 qualification, master's qualification in optometry. So potentially, 4 or 5 years time, optometrists will be exiting with their optometry qualification and their independent prescribing qualification, coming onto the register, with a significantly improved suite of clinical skills, ready and able to deploy them to the benefit of patients.
That's absolutely amazing. I might need to go start the whole process again if that's the
Oh,
case.
go and do it.
But I think it's really important for optometrists to upskill. And I think in recent years, especially since COVID, people are looking into it more and more and more. Reason being because they're seeing so much technology come out into the system and replacing or perceiving to replace what they do on a daily basis, for example, a refraction. And everyone is concerned that will I have a job in 10, 15 years if I just carry on doing what I'm doing now? Or do I have to expand my set of skills and provide a service that other people are not qualified to do so that I'm more of an asset to wherever I do work? And I think that's critical at this point in time because technology is coming to a point where it's doing a lot of what we can do in terms of refraction. But it won't replace us because of the empathy and the skills and the level of care that we can provide to the patient. But people are also worried that it will deregulate the profession as well. What are your thoughts on that?
So, in interesting and complex arena, we had a council meeting. Our board, our governing board, is called our council. And we had they meet in public 4 times a year, and we had a council meeting last Wednesday. And about 2 hours of that council meeting in the morning was devoted precisely to this subject.
Okay.
And I think the really important message there is that nothing will replace the application of the clinician's professional judgment, and the use of technology is there to support the clinician's professional judgment, to provide information, but it will never replace that professional judgment. And over time, technology will change; it will become potentially more sophisticated, but at the end of the day, the clinician, the registered optometrist, dispensing optician, is responsible, is accountable for the application of their judgment, their decision that they make, and obviously using our standards and guidance issued by the professional statutory bodies as a sort of touchstone there. We've embarked on a call for evidence that I described earlier, and as part of that call for evidence, we were really keen to receive evidence as to whether our current statute provided any barriers to the adoption of technology or the development of technology and its utilisation in practice. And what we learned broadly was that the answer was no. That actually our current legislation and potentially our new legislation would be sufficiently fleet of foot to allow technology to develop and support clinicians in practice. But it was, it provided a sufficient scaffolding for optometrists and dispensing opticians to work to their full professional capability, which is the phrase that we like to use at the GOC. Having said that, we have put down a marker that we're going to do a piece of policy work over the next 12 to 24 months, looking at how the sight test is conducted and the use of technology. And we're going to be running a seminar sort of internally to learn a little bit more about artificial intelligence and its application in practice, so that we can be sensitive to these developments.
Do you think there is a risk of deregulation to refraction specifically?
Well, the sight test is described in our legislation, the sight test rules, which I'm sure you're familiar with, and we've had no indication whatsoever from the Department of Health that there will be a deregulation of the sight test, or the sight test rules will be removed from our legislation. They might change as part of that future regulatory reform piece that I spoke about. If they did, it would be informed by evidence that we would provide to the Department of Health and that the sector would provide to the Department of Health. And I would imagine that it would probably be no more than an updating potentially of language, for example.
Fine. So exciting times, but also scary times. I think as long as we carry on upskilling ourselves, there's always going to be a place in the industry for the optometrist.
Oh, most certainly. Most certainly.
Good. Common theme of discussion around this time of year is, are GOC fees justifiable? What does my £380 get me?
Yes, interesting question. And of course, we held the registration fee for 3 years during the pandemic. We didn't put that fee up. We felt it was necessary to put it up this year by 5.4%, so well below the level of inflation, but nevertheless an increase. I just want to remind everybody that if you are struggling financially, we do have a low income fee as well, and several hundred registrants each year take advantage of that. So do ring up our registration team or email our registration team if you want to find out a little bit more about our low income fee. To answer your question more broadly, I would take you right back to the answer I gave at the beginning. We are a creature of statutes, we're a statutory body, and there are a number of statutory functions that we have to discharge. And we have to do that by balancing our books. 98% of our income is our registrants' fees. So about this time of year, all of our registrants pay their registration fee, about £10 million a year. And that's our business model, really. We're a subscription-based business. So we get the income in at the beginning of the financial year, and then we have to manage very carefully how we spend it during the year. About half of our income goes on our staff. So we have about 100 full and part-time staff at the GOC. We also have a large number of registrants and lay people engaged as members of our panels and committees, as education visitors, about a further 150 people also, and they're also remunerated. So that's a significant amount of our budget goes on people. And then the rest of our finances goes on, discharging our regulatory operations. So to run a register with 33,000 entries requires a considerable IT infrastructure, and we're making some significant improvements to my GOC and my CPD so that it's more responsive and technologically efficient. We have to run our fitness to practice operations, so that there's an expense attached to that. Although we have made significant savings over the last couple of years, in that now about, I think, 88% of our substantive hearings are now all held remotely. So we're saving significant amount of money on travel and premises and accommodation costs and things like that. So that's allowed us to keep the lid on registrant fees. And then
Fine.
all of the other things that we have to do as a statutory body, which probably feel quite alien to those of you who work in commercial practice. So as a statutory body, for example, we have to demonstrate our compliance with the public sector equality duty. We have to write a report to Parliament each year on how we do that. We have to lay our accounts before Parliament. We have to have corporate complaints processes. We have to be able to respond to freedom of information requests. And all of this has a sort of resource requirement that's attached to it.
So a lot does go into it, more than people think. So thank you for that explanation. Just touching on the IT bit, actually, is something that just came to my mind now. It'd be great to have an app, my GOC app, where you can log on, see the latest newsletter, or see the latest piece of information in the industry. I'm not sure if that's something that's gone through your minds there.
That is a brilliant suggestion. We're scoping at the moment changes to my GOC, and I will put those ideas into the mix. Thank you.
I think it's all about being accessible to your registrants.
It is.
And if the registrants are more accessible to the GOC, there's a better line of communication and there's more cohesive relationship rather than us and them. And just a simple app where someone can easily read the latest piece of information rather than having to log onto the website might make a difference. But yeah, thanks for putting that forward. So just to finish off with, I just want to ask, what is the GOC doing to engage with the public and the patients in its decision making?
So patients and the public are at the heart of our decision making. Our governing council that I mentioned earlier, appointed by the Privy Council, they're 50% lay, so that means they're not optometrists or dispensing opticians. They are the patients and the public. So our main governing body is has an equal voice of lay and registrant. All of our consultations and policy development work engages patients in the public strategically and at a local level. We currently have arrangement with the General Pharmaceutical Council where we use their patient and public panel. They have several hundred people on that panel, and we've used that panel most recently to seek patient and the public input into proposed changes to the way we might record gender on the register. We then have lots of committees, as you might expect, and on each of those committees, there's generally at least half of patient and public voices. Some of those are expert patients. Some of those are individuals with experience in business, for example, or professional statutory regulation in another sector. So there's a range of voices that inform our decision making.
Great, fantastic. Thank you very much. That was a very, very informative half an hour. Thank you for your time. I know you must be very busy, so I really do appreciate you coming on and giving us a little bit of an insight into the GOC and all the regulations and all the departments that you work with to improve the quality of the industry. So thank you.
Hassan, it's been an absolute pleasure to speak to you this afternoon. I'm delighted to have been invited, and hopefully some of the things that I've talked about this afternoon will be of interest to your listeners.
Fantastic. Thank you very much. Take care.
Thank
Bye-bye.
you.